So today we will learn about corrosive or castic injury to esophagus. Now, first of all, if there is any substance of pH less than 2 or more than 12, it will cause a severe injury to esophagus, and even if it enters the stomach, to stomach. Now, in children, it is accidental, but in adults, it is suicidal. Now, what type of agents are there? There are two types of agents, an acid and alkali. Acid works by donating protons, alkali works by accepting protons. Acid is present in carpet trees and anti-rust compounds, whereas alkali is present in washing powder and bleaches. Acid works by causing necrosis, but this necrosis is limited, so there is no deeper penetration of acid. Now, as there is no deeper penetration of acid, it can move down the esophagus very easily and it can enter into the stomach. So, whenever a patient is having an ingestion of acid, his stomach will be more damaged as compared to his esophagus. On the other hand, a patient who has ingested alkali will have a very deeper penetration of that alkali and it will affect his esophagus very severely. Now, what kind of clinical features a patient of castic or corrosive ingestion will present to? Now, it depends upon the type of agent, it depends upon the amount of substance that has been ingested, and it depends upon the amount of damage it has caused. Like, it depends upon the severity or pH of that substance, on the basis of which the clinical features will appear. Now, they range from dysphagia, pain in the mouth, epigastric pain, hoarseness of voice, and hematemesis. Now, in severe cases, even there could be perforation, fever, chest pain, and hypotension, and even peritonitis can occur. Now, talking about the management of a patient who has presented in the emergency with a history of an intake of any substance that could either be an acid or alkali. First of all, the very first step is initial evaluation and resuscitation of the patient following ABC guidelines for saving the life of a patient. Now, after resuscitation, we see whether the patient is hemodynamically stable or he is unstable. If the patient is hemodynamically unstable and we are suspecting that he or she may be having a devastating injury, we will ask for an X-ray. Now, X-ray will help us to see if there is perforation or not. They will do an extensive debridement of the dead tissue along with esophagectomy. Now, another option is that if there is an extensive damage to esophagus as well as stomach, there could be a procedure done that is called as esophagogastrectomy. Now, on the other end, if the patient is stabilized, we will ask for an endoscopic evaluation. Now, an endoscopic evaluation is a must thing to do within 12 to 24 hours of ingestion for grading the disease. Now, first degree damage is defined when there is only a mucosal hyperemia and edema. Second degree is when there is limited hemorrhage, but along with that there is ulceration. Third degree is when there is slough of mucosa, there are deep ulcers, there is massive hemorrhage, and there is a lot of dead tissue. For first degree, we have to observe the patient, pass NG tube, and eventually discharge him. But for second degree, we have to give the patient antibiotics and we have to do serial endoscopy for the evaluation of the patient. But for third degree, operative management is the definitive treatment. Now, talking about complications that can occur as a result of ingestion of corrosive substance. Now, there could be esophageal stricture, esophageal carcinoma, and tracheoesophageal fistula. Thank you very much for your patient listening. If you like my lectures, subscribe to my channel and share this video.